Now, new data shows children born now are likely to face a longer period of bad health when they're older compared to their grandparents. The study by the Office for National Statistics also sheds light on life expectancy depending on where a person is born. Well, joining me now from Swansea is sociologist Dr. Ashley Frawley. Are we, to put it bluntly, experiencing more difficult older years because we are living longer?
To a certain extent. I mean, it's important to put these statistics into perspective. The long-term trend has been toward increasing life expectancy and increasing healthy life expectancy. It's easy to create a bit of a panic by projecting the worst years, which could be anomalous, forward into the future. I mean, the general trend, even with a lower year, is toward great improvements. Now, of course, people may experience more chronic illness because they survive what would have been a catastrophic illness in the past and are left with, chronic illness as a result of that. But, they would have died in the past. So it's important to keep these statistics in perspective. It's not that we are, uniquely unhealthy now, or that we're quite likely to be very, very unhealthy in the future. It's quite complex.
Well, indeed, because you would think that many people these days are living healthier lives. There is certainly greater awareness of health and nutrition than perhaps there was 50 or 100 years ago. But is that translating into health differences in reality?
It really depends. I mean, there's one side of this, which is that certainly people today are more likely to conceive of themselves, to consider themselves less healthy than was the case in the past, even though objectively we're much healthier than has ever been the case. I mean, throughout human history. So if you talk to young people, they're less likely to consider themselves healthy because they see health as something that needs to be pursued. And so it's very hard to compare objectively how healthy people are with the past, because they're more likely to be aware of all sorts of symptoms and to report symptoms and to conceive of themselves as unhealthy, whereas people living with chronic illnesses in the past would have considered themselves healthy because they weren't literally dying. So it's important to keep that into perspective, put that into perspective as well.
So we are just all a bit more moany than we used to be.
To a certain extent. When I've been looking at this particular study, what's interesting is the way that it's being framed as a kind of intergenerational issue, as though today's pensioners are like living it up, and the young people today are going to experience very bad health. That's not really the case. It's weird to frame it as an intergenerational issue because actually the biggest disparities are between social classes and regions, between London and the rest. Really, there are stark health inequalities between people depending on how much money you have. And that is much more of an issue. And it's weird that we're being increasingly encouraged to think of things like this as though it's the older generation that are sort of stealing from the young. And that can kind of create some not necessarily good policy outcomes, like removing money from social care and things like that, or not enough political support behind pensions, for instance, because we framed it as like the older generation has all the good stuff and the younger generation is suffering. And that's not the case. There are serious class inequalities and particularly health inequalities in relation to social class.
Were you surprised about the differences regionally? You touched on the fact that, in London, very different figures to in other parts of the UK. Were you surprised by that?
No, not at all. I mean, this is something that's been reported for several decades. There are stark inequalities depending on where you live, and that is associated with your socioeconomic status, your social class.
OK, fascinating stuff. Great to talk to you. Thanks so much for joining us.
Thank you.